Today we're going to talk about peer-assisted learning, the concepts, research, benefits, and potential issues. Peer-assisted learning is not a new concept. It's also called peer-assisted coaching. It is well supported by research as a method of learning in many different programs and especially in health education programs. Some clinical instructors do support this in the MPT program at U of S. There isn't one definition of peer-assisted learning, but there's some concepts. Students with equal status actively help and support each other in learning tasks, especially in problem solving and critical thinking. It is not the same as two learners in the same environment learning separately. Students disclose knowledge gaps and questions to each other. They must trust and communicate with each other. They observe and provide each other with feedback. They set shared goals and help each other to succeed. In true peer-assisted learning, it should be a win-win. And importantly, they should cooperate with, not compete against each other. Some guidelines if you decide to take on peer-assisted learning. The student and the clinical instructor will work as a team, with the students working as equal peer coaches. Some cases are shared and some are independent. In shared cases, one student assesses while the second learner observes or assists. When assistance is needed, the peer should be the first contact, i.e. the first line of defense, followed by the clinical instructor. Peers use each other as a resource. Communication between peers is encouraged, as are regular meetings. The important concept in peer-assisted learning is the collaborative practice of learners. Collaboration is a very important competency. Students collaborate to identify their strengths and weaknesses with each other. They collaborate on clinical issues and problems. And individual team members support team development through their behaviors. By the way, you can't control the behavior of others, but you can choose to behave how you react to each other. And hopefully this is learned in peer-assisted learning. The research has shown many benefits for students, clinicians, and patients. The benefits for the students include learning as a social process that can be enhanced by peers, that there's a greater level of achievement in clinical reasoning compared to similar novice students completing concurrent or traditional placements. There's been shown to be increased competency, especially in the areas of collaboration, communication, self-reflection, and management. An increase in self-confidence and self-image in peer-assisted learning placements, as well as a sense of safety and reduced anxiety to have a peer by your side. The delivery of feedback to others is enhanced, as is the increased ability to consult literature and evidence to support clinical learning. The benefits to clinicians include increased student independence and less reliance on the clinician. It's been shown to have increased productivity as students take on their own caseloads. In rural or remote placements, there's less responsibility in supporting social isolation. And it's an extra set of hands, for example, with transfers and ambulation. Some of the benefits for patients have been shown to include opportunities for deeper exploration of clinical problems in complicated cases when you have two researchers working on your case. There's more care and attention with a dyad of students, and students working together providing more options for patient care. We can't go through this without identifying some potential issues, but there are ways to mitigate that. In some cases, the students do compete, although we do guide them not to do this. There can be challenging relationship dynamics between students. There can be differences in student confidence as well as in their learning styles, and also in their skill levels. If the students are significantly mismatched, you may have to switch from a peer-assisted learning to concurrent or traditional placements. There may be logistics, including limited space and limited caseload. There may be less individual supervision time for each student. And the workload for the clinician includes pre-planning, frequent meetings with students, ensuring effectiveness for a dyad for each learner with double assessments as well. The references for the research that is provided here are shown here if you want to dig into this further. And lastly, thank you. We hope that you try to take this on, as the benefits do outweigh the issues, and there are ways to mitigate the issues, and you're well supported by the clinical coordinators. Thank you for your time today.